पंजाब टुडे देख रहे दर्शकों का एक बार फिर स्वागत है हमारे एक्सक्लूसिव शो सेहत टुडे में। हमारे आज के स्पेशल गेस्ट हैं डॉक्टर YM अग्रवाल, MBBS, MS and more than 50 years of experience in general surgery. Welcome sir.
थैंक यू सो मच
सर, क्योंकि आपको 50 साल से भी ज़्यादा का एक्सपीरियंस है, सबसे बेसिक क्वेश्चन से मैं स्टार्ट करूंगी. हाउ ऑफन शुड वी मीट डॉक्टर्स एंड व्हाट हेल्थ स्क्रीनिंग्स आर रिकमेंडेड?
What I will suggest is that one should always keep in mind that the first and foremost thing is, even without meeting a doctor, you should know that you have to take care of your health. And for taking care of your health, the basic thing is you get up early in the morning, do physical exercise, some pranayama, some yoga or deep breathing exercises or physical exercise, because you start your day in a better way. That is the main thing that I want to tell to all patients, that your whole day activity depend on how you start your day. This is your life. You either use it or lose it. That's the point.
जी सर. सर, हेल्थ स्क्रीनिंग्स कौन सी रिकमेंडेड है जो क्रिटिकल हैं, जो हर किसी को करानी चाहिए टाइम टू टाइम?
From time to time, you should take care that your weight is all right, your blood pressure is all right, you can hear normally, you can see normally, your 5 senses are normal. And then main thing is that you get your BP checked it depends on the age, but generally I will suggest that once in a year you get your BP checked. For older people we may suggest that every 6 months they get their BP check, or even after 3 months, but it depends. If the BP checked once is normal, then you need not go in every month or 2 months to the doctor. And secondly, your serum cholesterol level, that is also very important. Then kidney function test means blood urea, serum creatinine. So these also should be always kept in mind. Yeah, sugar is very important, because India is a country where there are lot of diabetics, and diabetes is one disease which will affect almost all the organ of body. Diabetes is not simple passing of sugar in blood or in urine. It affects almost all body organs, right from head to toe. So you have to be very, very careful that your blood sugar is within normal limits, and that can be controlled. I don't think that you should think that diabetes is one disease which cannot be controlled, and even if you visit a diabetologist and he suggests some medicine, don't think that you are going to take that medicine whole lifelong. If you keep control of your health, if you do proper physical exercise, and mainly you take proper diet, that is very important. And in your diet, you increase the amount of fiber that you are to take, because fiber is very good to maintain the health of your intestines, as well as for proper evacuation of bowel, and to guard against sugar also.
In some cases I have seen that diabetes can be reversed also following these things.
Many cases of early diabetics can be reversed, and if secondary diabetes especially can be reversed. The diabetes is of 2 types. One is diabetes which is
insulin dependent.
Insulin dependent diabetes, that may not be reversed, but you should take proper dose under proper guidance of a diabetologist, and should not take insulin haphazardly without consulting a diabetologist. I have seen people who risk their lives, because in my own opinion I have seen many patients who are attending a marriage function and eating jalebi and imarti there, and like all others, and putting up insulin themselves. So many times I have to tell them, why are you taking insulin yourself without even consulting a doctor? They say, well, I wanted to take this jalebi, so I took it. So that attitude should not be there. You should try to keep control over your tongue, and don't take a lot of sugar and sugary sweets without the consultation of a doctor. If you want to control diabetes, especially diabetes.
सर सर्जरीज पे आते हैं. कॉमन जनरल सर्जरीज कौन सी हैं?
The common surgery, we say the bread and butter of a surgeon is hernia, hydrocele, piles, appendix, and simple stones. So they are the simplest surgery. Otherwise, I can say that minor surgical work means glands, minor tumors, small lumps over the body, lipoma, and things like that. They are the commonest part of surgery, and nobody is to fear from those surgery, because they can be cured very simply, especially these days. In our time also, surgery was this type of surgery was very common and very simple.
So what are the common risk, benefits and complication associated with these surgeries?
You see, if there is a small lump in a body and you ignore it, now if you don't go and consult, especially I am talking about the lumps in the breast, because I have seen young girls, they feel shy in going to the doctor and telling them that they have got a lump. They don't even tell to their parents about the lump, and that is bad. Once we always used to tell patients to do self-examination, and if on self-examination they find that there is any lump in the breast, they should immediately tell their parents, and parents should take them to the doctor, because doctor is the best guide for them, and doctor can tell them whether this lump can be removed, and most of the breast lumps can be removed surgically without there being any harm later on. But if you leave a lump like that, it can turn into 99%, it may not be cancerous, but 1% of them may go in for cancer also. So early detection leads to cure. This is the guideline for even for the cancer treatment.
सर कुछ लम्स वाटर बेस्ड भी होते हैं, जैसे डॉक्टर कहते हैं मे नॉट बी कैंसरस, तो वो कैसे डायग्नोस होगा और कितना ऑफनली उसको टेस्ट स्क्रीनिंग चाहिए होती है?
You see, the main drawback why cancer is there, because generally the cancer lumps are painless, and the painless lumps people ignore. There is not going to give them any trouble, so they ignore it, because it is just a lump. They think it is a lump and they leave it. I have seen many people having a lump over the head, and then I tell them, it is cosmetically looks very bad, and I told them, well, why don't you get it removed? And they say that it may affect my brain, it may affect other thing, without thinking and without asking a doctor that this lump is above the brain, it is above the skull, so it's not going to affect anything, and for a surgeon it is hardly 10 minutes job, and for patient it is harmless. But they think that this is a lump, so they don't go to the doctor and they don't want to get it removed by the doctor, thinking that it may affect the brain. So in the same category, I will tell that there are many things which you should always keep in mind to avoid it turning into a cancer. If you at any time you feel that there is any change in your bowel habit, any change in your urine habit, any change in your especially in ladies, if there is little bleeding and over bleeding from the vagina, and if there is change in bowel habit, means you are either constipated or there is lot of diarrhea,
irregular periods also.
Irregular period also, and then there is a bleeding from mouth, bleeding from nose, bleeding from ear, or hoarseness of voice, difficulty in breathing. So all these signs point to there may be something bad in the lungs, there may be something in the heart, there may be something in the throat, there may be something in the breast, there may be something in the rectum, something in the anal canal, or something in the urinary passage.
जी.
So, you or there is a small lump in your body which you find that suddenly it is growing,
जी.
or there is a small scar or small mole
Okay.
which you find it is changing,
जी.
or there is itching on the mole.
Okay.
So, that may be a melanoma, and you should not ignore it, because at a later stage it may turn into a malignant melanoma,
जी.
which is a dangerous disease.
जी.
So, my only contention is that early detection leads to cure. So, be always vigilant that if you find there is any change in your body, immediately get it checked by a doctor, and most of the doctors, they know it. You need not go to a specialist, but even the general doctors who are sitting in the city, they know about common things, and they will tell you, then a good doctor will always guide to a specialist, and then the specialist will treat accordingly.
सर, जैसे आपने मेंशन किया कि ब्रेड एंड बटर ऑफ सर्जन, ये जो कॉमन सर्जरीज हैं, हर्निया, स्टोन, गैल ब्लैडर रिमूवल, सर्जरी itself एक फोबिया है. So are there any alternatives to surgery?
You see, there are what I feel is that once you find that I am talking about the common surgeries.
जी.
So when you find there is a hernia,
जी.
now hernia, previously people used to use different devices for control of hernia, and one device was called truss, 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 that they used to press that portion of from where the hernia is coming out and tie it, but gradually they found that the area which is tied get weak, it is weaker, and then at a later stage if you want to operate, it becomes difficult to operate. Then you are always to do hernioplasty, not herniorrhaphy. Means you are always to put in a shield there or a wire mesh there as a repair. So, truss is no longer in use now, but in olden days it was there. So, surgery is always advisable as soon as it is diagnosed, because getting surgery done and getting the disease removed is always better than to linger on, because it is going to increase. Hernia today is smaller. If you leave it and you go on doing your work, then it may become bigger and incapacitate your daily routine, and your life may become difficult. So, similar case with piles. Now, you go to a patient, you go to a doctor and you tell him that you are suffering from pile. I have, in my practice, I have seen patients who came to me for piles, and on examination and their proctoscopy, I found that there is no pile.
Okay.
It was a simple fissure
जी.
or a simple tag outside.
So that is not pile.
That is not pile.
Okay.
But many people, whosoever comes to us,
जी.
he always thinks that if there is anything in the anal canal or outside the anal canal, that is pile. For them, everything is pile.
जी.
But for a surgeon, there is a difference between a pile and an external pile and a fissure. There is a lot of difference.
जी.
And pile, whether it is a stage 1 pile, stage 2 pile, stage 3 pile, because then there is a different treatment for all these type of piles also.
जी.
Stage 1 pile can be treated even by injections or simply by conservative means if you avoid constipation, because pile is one disease which is due to straining on stools. If you have lot of constipation and you are straining, then due to that pressure the pedicles come out and then the pile forms.
जी.
So, to avoid it, you treat it at number 1, stage 1.
जी.
Why to get it to number 2 or 3? Because if you reach stage 3 of piles, there is no treatment except surgery.
Okay.
And then the surgeon also cannot do anything.
जी.
And I have seen patients coming with prolapsed piles,
जी.
where it is beyond stage 3, and then there is no alternative at all except to do surgery.
जी. सर, प्रिवेंटिव मेजर्स की अगर हम बात करें कुछ कॉमन कंडीशंस की, सो व्हाट आर दोज प्रिवेंटिव मेजर्स?
first preventive measure is to be careful and to keep in mind that your everything is normal. And if at any stage in life you find that there is difference in your stool or difference in your urine, you must consult a doctor, because even now people come to us with the frequency of urination, burning micturition, and difficulty in swallowing. So, if you treat them you tell them right at that stage, preventive measures means early detection. So, indirectly it is the same thing, that whenever you find that there is any change in your daily system, you should consult a doctor without ignoring it. Don't ignore even the early signs.
जी सर. So अगर हम बात करें प्रिवेंटिव मेजर्स के बाद, कॉमन रिस्क और कॉम्प्लिकेशंस ड्यूरिंग सर्जरी एंड आफ्टरवर्ड्स वो क्या क्या होते हैं?
Mainly for the general surgery there is hardly any complication, because surgeon himself is very conscious of the fact that after surgery the patient should not have any complication. And only thing he will tell the patient that if he finds anything after that, he should visit him immediately. But 99% there is no need for the patient to visit the doctor, because the surgeon at the time of closing the after surgery, he makes it sure that there is no complication. But still, if you find there is any problem, you should consult the doctor immediately, report it.
जी सर. सर, आफ्टर सर्जरी एज अ पेशेंट व्हाट आउटकम वी शुड एक्सपेक्ट? क्योंकि ऐसा कईयों को लगता है ना कि सर्जरी होगी तो मिरेकल हो गया है, तो अब तो ऐसा होना चाहिए. सो what outcome?
99% the doctor will himself explain to the patient that this is going to be the result of your surgery. And I think the doctor never hides from the patient what is going to be the final result or final outcome of a surgery. If he is repairing a hernia, no problem. If he is repairing a pile, no problem. If he is repairing removing an appendix, he has removed it, there is no problem. So, normal course, if you are removing a gallbladder, he remove the stones, and now in the gallbladder you remove the gallbladder itself, because it is a cholecystectomy. So, remove the gallbladder. So, generally there is no complication. So, mainly what I feel is that the patient should not expect any complication after surgery. And if there is anything, the doctor will himself explain or he will take care of it.
जी सर. सर, पोटेंशियल रिस्क फैक्टर्स एसोसिएटेड विद सर्जरी क्या क्या हो सकते हैं अगर हमें खुद को सर्जरी के लिए प्रिपेयर करना है? एज, ओबेसिटी, इससे रिलेटेड आर दीज पोटेंशियल रिस्क फैक्टर्स?
Now what I feel is that there is hardly any potential risk factors. Previously there was a little difference between operating on a obese patient, there was a difference between operating on a hypertensive patient, but now with the advent of latest set of medicines and surgery, there is hardly any problem. Only thing is that you should wait for a couple of days till your BP is controlled, your sugar is controlled, your mindset is all right, and patient should be fully set before taking up the surgery, that he is mentally and physically prepared for the surgery. Because emotional factor is very important, that emotionally the patient should be fully prepared that he is going to do surgery, and he should have a full faith in the doctor, that whatever the doctor will do for the good of the patient. That is very important. The doctor does everything for the good of patient, and the patient in return should also have full faith in his doctor. And if there is something or something bad happens, he should think in his mind that it is not the fault of the doctor, because the doctor will always try to save the patient. And I have seen myself that when we operate on a patient, we try to put our life in the patient's body. We try we try our best to do whatever is possible for that patient. Now, rest, it all depends on God. I treat, he cures. That is my motto.
सर कैंसर डिटेक्शन कैंप्स में आपने काफ़ी काम किया है, तो कैंसर डायग्नोसिस और प्रोग्नोसिस की बात करें तो उसका विश्लेषण आप कैसे करेंगे, क्योंकि जनरली पेशेंट्स को लास्ट स्टेज पे पता लगता है कि वो कैंसर से जूझ रहे हैं.
I told you that because cancer is a painless disease, it goes on increasing and the patient comes to know of the cancer only when there is pain. Without pain, the cancer doesn't spread. So, once there is a pain in any part of the body, that shows that if he has cancer or anything of that type, the cancer is spreading. It is attached to some portion of the body and then irritating the nerves, and then there is pain. So, when the cancer starts in any part of the body, it may be inside or outside, there is no detecting signs outside except that the little hoarseness of breath for lungs, difficulty in breathing for lungs, difficulty in swallowing for throat, gradual increase in lump in breast, a small passage of blood from the vagina or cervix, and difficulty in passage of stool. So, if he reports to the doctor even at that time, the doctor may do the PR, may do the examination of the ladies and palpate the breast or see his throat from the means bronchoscopy and other gadgets which are available, and then he can diagnose. But once there is bleeding, means he is having bleeding from the mouth, bleeding from the stools, bleeding from the urine, increased bleeding from the vagina, and then the problems is that the cancer has already spread. Because we tell to our patients that you report as soon as there is any sign of that type. So, main problem is that patient should be vigilant and not ignorant.
जी सर कुछ मिथ्स हैं सर्जरी से रिलेटेड कि इफ़ यू हैव स्पाइनल इंजरी यू वोंट बी एबल टू मूव, इज इट ट्रू?
Spinal injury, yes, you should not move, and main thing is that you should try to keep him straight. And if you want to transport a patient with spinal injury, you should try to keep him straight and put in a hard bed under his spine and then take him to hospital for the final diagnosis and treatment. Because if you move and there is some injury which is affecting the spinal cord, then after movement you may do more damage to the spinal cord than what has already taken place. So, this myth is right.
Adverse events can occur due to overdose of anesthesia.
Yeah. So, you should always get it the anesthesia done by a competent anesthesiologist, because sometimes people fear anesthesia more than they fear surgery. And I have seen patients even in my career where it was very difficult for the patient to come out of anesthesia. Surgery was over, but the patient never came out of anesthesia and had to be taken care of with great difficulty. About anesthesia, I will tell you a very personal example. Once I was in Iran. I was operating on a young lady with a small adenoma of thyroid. So, in that when you put anesthesia, the neck is extended at the back. The anesthetist extended the neck, gave the anesthesia, put in the pipe, and he had to immediately go to the other theatre for some other surgery. I started my surgical work, but I found that the patient was not bleeding when I put in the incision. I immediately called the anesthetist. He came and he found that the intratracheal tube that which he had put in for anesthesia had come out, and the patient died. Who was at fault? Not the surgeon, because the anesthetist, because he had left his patient and gone to the other theatre without thinking that this is to be supervised. So these things do happen, not intentionally but unintentionally. So these are the risks of anesthesia also. Overdose of anesthesia, you said, okay, these things are there, but still you have to take care. And now there are a lot of advancement, and there are so many subspecialties even in anesthesia.
To decide the threshold?
No, subspecialties. I mean that for a heart surgery there are different anesthesiologists, for a brain surgery there are different, and they are trained in that type of anesthesia which is needed for that particular type of surgery. So this is the advancement which we have heard and we have not seen in our time.
जी सर, बिल्कुल. सर, आखिरी सवाल, ये जो घर घर में आजकल डॉक्टर्स बने बैठे हैं गूगल ज्ञान की वजह से, सो हाउ डेंजरस इज इट?
आई थिंक दिस इज वन ऑफ द मोस्ट डेंजरस एंड डिफिकल्ट ट्रेंड फॉर इवन फॉर द डॉक्टर्स, दैट द पेशेंट कम टू देम and they started talking in the terms in which the doctors also don't talk, in a way that we always say that half knowledge is a dangerous thing, and they don't know anything much about it, but this is what they have learned even from the Google or from YouTube, and this is very dangerous. And for the doctor, he will say to the patient himself that you first go to Google and ask him what to do, then you come to me. So this is a very difficult and bad trend, and I won't recommend it to anybody. He should rely on his doctor and not on Google.
Thank you so much for your views, sir. अच्छा लगा आपसे बात करके. Valid information we got.
Thank you so much.
So ये थी हमारी. Thank you so much, sir. सो ये थी हमारी आज की मुलाकात. अगली बार फिर हाजिर होंगे नए चेहरे और नई इन्फॉर्मेशन के साथ. तब तक जुड़े रहिए हमारे चैनल के साथ. धन्यवाद.